Steve Biko Hospital denies allegations that its oncology unit is on the verge of collapse. More on that story coming up. Security experts believe it's time for specialised police units to be rebuilt to help lower crime levels. I'll have details for you on that in just a moment. And Cape Town's Mayor Patricia de Lille arguing that her case in court, saying it's not only for her own political future. Full updates from the Western Cape coming up. Good afternoon. The Steve Biko Hospital is denying that its oncology ward is on the verge of collapse. Reports recently emerging that about 934 cancer patients are waiting for radiation treatment. But the hospital says it's providing first-class medical treatment.
This is one of the two designated institutions that are providing comprehensive cancer treatment. By comprehensive, we mean it provides all modalities that are required for cancer. We provide treatment through radiotherapy. We provide treatment through chemotherapy. We provide treatment through surgery. We provide treatment through nuclear medicine and hormonal manipulation we do. The issue at hand that is being investigated was the allegation of having 934 patients waiting for radiotherapy. Clarify that radiotherapy get provided through 4 stages. There's a stage, first visit, where you get assessed by the doctors and confirm that the type of cancer that a patient has indeed will require radiotherapy. Then after the doctors have confirmed, then the patient has to be scanned. That is another list waiting. Then there's a third stage, is a stage of treatment planning, so that they know exactly which part of the body and where in that part of the body is the radiation gonna happen. And then then the 4th stage is where you'll get into a machine. We need to also emphasize, because there was an allegation that because of the long waiting periods, the survival rate outcomes were poor. In the main, our society still present late for cancer treatment, and majority of patients actually come for pain control rather than to be on remission. Because as you know, with cancer, we can never say cancer is cured. You may find that a person is cleared now, and then few months or years down the line, the cancer reappears. But we believe that we are providing first-class comprehensive cancer. Yes, cancer treatment. We took the team around to see it happening. They indeed found patients that are being treated, and all 4 of our radiation machines are working, plus 1 that we called brachytherapy. And we are installing now a new machine, high-end, that is, we are still building a bunker, because these machines are getting housed in a bunker. And then that machine is already in the country. Of course, most of these big medical equipments get shipped from overseas. We don't have them around, but the machine has arrived. As soon as the bunker is completed, the machine will be installed, and then we are expecting more progress in that regard. The 2018 February that is referred to, actually we had 370 patients, not 934. The 934 aggregated, remember I mentioned 4 stages, were coming from last year, February 2017, when 2 of our linear accelerator machines had to be put off, not because they were broken, but they were put off in avoiding them from overheating, because the air cooling system in their bunkers was not functioning optimally. And then we subsequently recently had repaired that air cooling system, and that air cooling system is having a maintenance contract by the original equipment manufacturer. And manufacturer, we don't expect any breakdowns or any putting off a machine, at least for the next coming 3 years.
And just briefly, once again, Doctor, in terms of the issue of maintenance, I would imagine that it's another critical matter because, I mean, running a hospital, it's quite a very enormous task.
Yes, indeed. And that's why our current machines, the reason why we are installing the new one is because the plan is that in the next 5 years or so, we'll be replacing one of them yearly. As we are saying, as we speak now, this year we are going to replace brachytherapy, the other smaller machine, because we are only now installing the new linear accelerator. Then next year it will be another one, because the lifespan, the actual lifespan is 10 to 15 years. Ours were acquired in 2005 and 2006, and now is that time to replace them. They are still very much functioning, yes, on the low side because of their age, but they are working very well, simply because we made sure that they are well maintained and they are up to date with their maintenance.
All right, certainly. Thank you so much indeed, Doctor. Really elaborating in terms of their plans and what they've done so far to mitigate the situation, dismissing some of the allegations. But of course, another very important player in this regard is the Human Rights Commission, which is now here by Mr. Jones from the Commission here in Gauteng. So just your reaction so far from what you've seen here.
Well, we are quite satisfied with what we are able to glean from this site inspection. We will, however, continue with our investigations, and hopefully by the time we conclude our investigations, some of the concerns would have been addressed by the management at the hospital. But we are alive to some of the challenges that are facing the Department of Health in Gauteng, but we have noted progress that has been made by the Steve Biko management in the provision of health services. We inspected the oncology facility, and we noted the improvements that have been made. We are quite happy that the cancer patients that come to the hospital are receiving the adequate treatment. Of course, there are other allegations of lengthy waiting periods and human resource constraints. Those are some of the issues we will continue to engage with the hospital to find out what are some of the remedial steps they will take in order to ensure that there are no occurrences that are related to shortage of staff or high absenteeism or low staff morale or lack of maintenance of equipment. We are going to request the hospital to supply us with their maintenance reports and with other reports pertaining to waiting periods, and to also look at their complaints management system. You know, when complaints come through, how are they disposed of? Are they working well together with the health ombudsman to ensure that the provision of healthcare in Gauteng is improved? We are also going to be engaging with the head Department of Health in Gauteng to discuss other challenges that are facing Gauteng, because some of these allegations point to the lamentable state of hospitals in Gauteng. So we will be engaging with them to seek actionable resolutions, because the time for talking is over. We need to see actions being taken to address socio-economic rights in South Africa, to address the plight of vulnerable groups in particular.
And just briefly, sir, before I let you go, the issue of the public health care in South Africa, there are all sorts of perceptions. So what's been your findings so far? Because you've been crisscrossing the province, making sure that everything is running smooth, because we know constitutionally health is one of those important, issues. So from what you can gauge, are we getting it right?
Well, I can't say we're getting it right. As I said, there are challenges in Gauteng, and there is a need to conduct a separate probe where we can now hold accountable the MEC, the head of department, and if needs be, the premier of the province. Gauteng, given its preeminent role in South Africa, given that it's the economic heartbeat, attracts a lot of migrants. And this has the resultant impact on the provision of healthcare services. So we are alive to the recent statistics that indicate that approximately 14 to 50 million people reside in Gauteng. So this then requires government to prioritize their allocation to Gauteng, because they receive referrals from other hospitals in other provinces and foreign nationals from neighboring countries. But we will continue to engage with the department. Chairperson, Professor Bongani Majolo, is already engaging with the health minister to find solutions to some of the challenges that are facing the healthcare sector.